My name is Dr. Luke Gregory and I'm a veterinarian from the Bonaron Wildlife Hospital. So every day we see injured and sick animals that come through our door here, and when we assess them, it's a very systematic process to how we examine them. So the first thing that we'll do is have a look at the history that's been provided with the animal. Have a look at whereabouts it was found, if it was found by roadside, which might suggest it was hit by a car, or for a bird of prey underneath a power line, which might suggest that it came into a collision with that. And so once we've done that, we'll do a conscious assessment of the animal. So we'll be looking at it in a room, and if it's a bird, we'll be seeing how it flies around, whether or not it's got a droopy wing or not, which might suggest that it has a wing injury. For a mammal like a possum, whether or not it's able to climb branches normally in trees, whether or not it's got a limp at all. And once we've done that, we'll do a basic neurological exam. So doing things like a pupillary light reflex, which once we anaesthetise the animal later on, we won't be able to do. And we'll also be looking in the room whether or not it's able to negotiate obstacles, or whether there are signs that it might be blind. We'll also be looking at whether or not it tries to avoid us or not, or whether the animal seems to be tame. And then once we've examined them consciously, we'll then physically examine them under an anaesthetic. And the reason why we do this is that it's very stressful for wild animals to be handled, and so it's much less stressful on them to be doing that while they're anaesthetised. And we'll examine them much the same that we would a dog or a cat in a small animal clinic. So we'll be examining from the head to the tail, and looking at all the body systems and making sure, or seeing if there's any abnormalities there. Sometimes we'll have a good feel of both of their wings or legs and try to find out whether one side is abnormal compared to the other. And then we may then choose to do diagnostics such as radiographs, bloods, sometimes fecal analysis or a urinalysis. And we'll focus this based on what we've seen on our previous examinations. And then with all this information, we'll make a decision as to whether the animal is a good release prospect. The animal needs to be able to thrive on release. It can't have any disabilities that might impact its quality of life. It also needs to be able to reproduce and not be a risk to other populations in the wild. And then with all this information, we can then make a decision as to whether the animal needs to be euthanized or whether it's suitable to go to care with the aim of rehabilitation and release.